Hello, my name is Jackie Simpson and I am one of the diabetic midwife coordinators in Royal Maternity. Today I'm going to explain to you how to use a glucose monitor. This will be given to you if you've been diagnosed with diabetes in pregnancy or you have been a previous gestational diabetic. The hospital will provide you with a little pink bag and there will be a diary and a letter for your GP to provide you with further things that you will need. In the bag there is a box and it contains your glucometer. So this is the glucometer. It doesn't need charged, it has a battery in it and that is it. Here there is a little tub of sticks and these are the little sensors. They do have a microchip on the end of them and this is what goes into the monitor to turn it on. So I always say the piano keys in and it turns your monitor on and it will display the date and the time. There will also be a little droplet and that's indicating that it's ready for your blood sample. I'm taking this out now because I'm not quite ready to demonstrate. Also in your bag, this is what we call the finger pricker. For the finger pricker, if you hold, there's two little beveled edges and you just unscrew. The lancet, which is the needle, is covered in green plastic and this goes into the finger pricker as far as it can. I usually say hold it by the broad Mickey Mouse ears and push it down in. And hold it and gently screw it off. We will say screw it off rather than bending it, because if you bend the needle you will not get it to prick your finger or it will be more painful. Then put the cap back on and that needle is covered, you're never going to see it. To activate the needle you pull out the navy bit at the bottom and then when you're ready to take your blood sample or prick your finger you press the green button. You will hear that click. There are also numbers 1 to 5 around the finger pricker. 1 and 2 is for babies and children. 4 and 5. 5 is for a man or a woman with hard skin if they've been out gardening. 3 or 4 should be fine for you. So I'm going to demonstrate on how to check your blood sugar. We do recommend that you change your needle every time you check your blood sugar. So, most important thing is wash your hands before you start. That's because food residue can be left on your fingers. We would also say to avoid using your pinchers because you use them all the time. So use these 3 fingers on each hand and rotate them around. The pads of your fingers do have nerve endings, so it can be painful. So we would recommend you prick the side of your finger. So I'm now going to demonstrate this. So I'm putting my piano keys into the monitor to turn it on. I have my needle in and I've washed my hands. I'm putting this at number 4. Put it to the side of my finger and press the green button. And then squeeze some blood from your hand down into your finger and place the sensor into that blood. It will suck the blood up and within 5 seconds you will have a reading. Mine is 5.6 today. Just remove the sensor and put it in your sharps box. Now I want you to record that blood sugar. So you have a diary. If you turn to the week that you are in your pregnancy, it will give you when we want you to check your blood sugars. So the bad news is it's 7 times a day. So it's before each meal, 1 hour after you've finished eating, and before you go to bed. And if you could record your blood sugar in the appropriate place. If you've eaten something and you realise it has put your blood sugars up, write a comment in the comment box. Just means that you will be aware of what foods do put your blood sugar up. Now, the other thing is, you will ask, what do we want your blood sugars to be? This blue line here has our blood sugar levels that we want. So before meals, we would like your blood sugar to be less than 5.3, and 1 hour after meals, less than 7.8. You're not on your own out there. We would ask you to email your blood sugars in. So take a picture with your telephone and attach this email address, which is diabetesnurses@belfasttrust.hscni.net. And we would say, email your blood sugars in every 2 weeks. However, if you have elevated blood sugars, do email them in more frequently, and you will get advice by email. The letter for your GP, if you can leave it in, it's requesting more lancet needles, more strips, and a sharps box. And if you have any problems, please don't hesitate to contact the Royal Maternity Helpline, and they will put you through to the diabetes services. Thank you.